like Trish that you come and do the slides and then I'll do it for you. Otherwise, I'll be walking out. Thank you for coming tonight. We're going to spend some time talking about drug overdose and then Narcan. So to start out with, I wanted to talk about just the state of Missouri. In the state of Missouri, this is a problem, drug overdose. We rank second to St. Louis in the statistical likelihood of dying of a drug overdose. And then as a state, these numbers just continue to rise year after year. That we're seeing increases in count of overdose deaths for all drugs to date, 15% increase from 2020. And the people are dying from synthetic opioids, they're dying from prescription opioids, and it is impacting all gender and races. So there really isn't a group that's suffering more, it's impacting everybody. Rates just continue to climb year after year. There's a statistic by the CDC that said in 2020, 75% of all drug overdoses were caused by opioids. And those are our prescription opioids, the things that you get from a provider to manage pain, other conditions, the ones that we kind of deem to be a little bit safer. So most often drug overdoses are unintentional, and it can be a result of many different things, sometimes just from mislabeled medications, sometimes improper dosage, sometimes from unintended drug interactions, so combining an opioid with a medication like a benzodiazepine or combining it with alcohol can sometimes cause reactions that we're not planning on. It can be a result of an unsupervised child that saw something and took it. No matter what the situation is that led to an overdose, it is a medical emergency, and the need to have appropriate intervention. Every second counts. For a couple of statistics, within 4 minutes there will be brain death. So when someone is laid out with an opioid overdose, within 4 minutes they're going to have brain death from that, or the beginnings of that. If you look at the national average for how long it takes for an ambulance to get to your house, the minimum is 4 to 7 minutes, and that's if you live in a suburban area. In rural areas, it's 9 to 15 minutes on average. I don't know what it is for our confined statistics specific to Dent County, but most of our community members live in rural areas here. So we're looking at, that 9 to 15 minutes. And if we can be the person who can deliver something within a couple of minutes that can help that person, we really have an opportunity to make a difference and save someone's life. So I'm going to talk for a second about the signs of opioid overdose. And these signs can look different on every single patient. It also can look different on what they may be taking or their age or other health problems that they have. But most of the time, they're going to be unresponsive. That's going to be our first clue that something is not right. They'll not respond, be unusually sleepy. They can have really small pinpoint pupils, limp body. They can be pale, clammy to the touch, have discoloration around their mouth, lips, fingers, and toes, cannot be awakened, unable to speak. Their breathing may be really slow. Their heart may be really slow or even stop completely, and they may be making vomiting or gurgling noises. It's scary to see for people. The most important thing is if you have somebody who is experiencing any of these instances that you do not leave them, that you administer aid and do not leave them unattended. So treating overdose, opioid overdose consists of a couple of different steps. If you can, get somebody else, if you have anyone else around that can call 911, the very first step is to get somebody calling 911. If it's only you, then get 911 on the phone right away, and then you're going to start administering first aid, delivering Narcan as soon as possible. The recommendation is to deliver Narcan and then to move forward with doing compressions or rescue breaths, depending on if the person has stopped breathing or is breathing. Oh, one thing, sorry, I wanted to go back on. There is the Missouri 911 law protects people for administering first aid to people who need it. So if you are a first responder and you see somebody who needs medical intervention under Missouri 911 law, the Good Samaritan law, it protects you from any liability for administering aid to that person. The other part of it that I think is really wonderful is that it also protects the person who's experiencing the medical emergency, that they will not face any consequences for minor drug and alcohol violations. So again, just reiterate that the most important thing for people is to provide aid to them and to help them. So I have a short little video on how to use Narcan, and then Trish is going to talk more about Narcan and how to use it.
Before we talk about what to do, it includes the three drugs, heroin, as well as prescription. Anyone taking prescription, the opioid, is at risk. Those who are at greatest risk, definitely. Take higher doses, mix opioids with other medicines, take consultation, or have legal. No opioid overdose. Parts of the leaking, overleaking, breathing, but people left. If you see any of these, you suspect an overdose, call 911. Then administer, also Narcan enabled. Remember, Naloxone will work. It will not treat an overdose. Maybe. Which includes Valium, and sand. Start removing the person with and follow the three peel, blades, straps. Take the spray out of the box, peel back the spray. Hold the spray with your first. Have the push first. Fingers on. There's only one dose. Then roll the person to the left. If they do not wake up, do a 3 minutes. Minister of death. Stay near them. At your local pharmacy, find the most convenient or detailed instructions on the use of sudden death caused by opioid overdose. First of all, we share the responsibility. Take care.
So what is Narcan? So it's an opioid antagonist. So basically what it's going to do is block that pharmacological response and the effects of the medication that you've taken, regardless of what it is. And it's instantly going to bring on those withdrawal effects. And that includes respiratory suppression. So if they're having trouble breathing or they're not breathing, hopefully by administering the Narcan, that's going to reverse that, where they're going to start breathing. So when that happens, though, you have to be very self-aware of what's going on. Basically, you're pulling away that high. Maybe not completely, but they can come out of that as disoriented. They can be swinging arms, potentially physically assault somebody and not meaning to, because you went from one extreme to the other, right? Because it does work very, very quickly. It'll get into their system. Sometimes people will actually need more than one dose. And so that's why, most of these come in packages of 2, just so you do have extra. But that's why it is so important to go ahead and make sure that you've reached out. If there's somebody else there with you, that they're calling 911 while you're administering the Narcan, and then you're ready to perform CPR, rescue breathing as needed as well. Okay, so for Narcan, They come in these nifty little boxes. Do we have one of them? Okay. So I will actually go on over it as well. So it has a breakdown of exactly what to do. So there's pictures for you to follow, very simple. Even if, you know, things are moving very quickly, you know, people, it's not a precise when it happens, but you can just step by step. You can tell somebody what to do, or you can glance at it really quick as well. So the first thing you're gonna do, you're gonna remove the nasal spray from the box itself. And then open another one. So they're individual. There's two in a box, but they're individually packaged. So then you're just going to peel it back as well. There's also another information sheet in here that you can open up and have right beside you if for some reason that box went blank. After that, basically, you're going to place your fingers here on each side. There's thumb right there for the plunger. You do not have to prime these. It is ready to go. You're going to slide it into one nostril. You don't have to close the other side at all. And then you're just going to on the plunger. It's very short, very sweet, and then it works very quickly as well. Okay, like I had said, they may need more than one dose. So it may work quickly, and then you notice also very quickly within a few minutes, sometimes depending on how much medication is in their system, they may require another dose as well. So again, very important that you stay with them, that you're monitoring them. You want to turn them on their side as well in case they do start to vomit. You don't want them to choke on that. So turn them on their side more in that recovery position. Also, if there's no response after about 2 to 3 minutes, you can go ahead and give that second dose. Sometimes, unfortunately, that one dose isn't enough to counteract whatever they've taken. So Narcan has no effect on somebody who does not have opioids in their system. So if it's a different kind of medication that they had taken, I know they had talked about earlier about, Ativan. If they've taken too much Ativan, it's not going to do anything. But still, you at least have, something there to at least eliminate one thing to try to save. Now, Ms. Brittany is going to go over safe drug storage and disposal. If you do have those extra medications at home, you don't know where to take them and so forth. The video first.
Patients who misuse medications most often get them from their very own home, a friend's home, or a relative's home. So in this video, we'd like to talk to you about the misuse of medications and the proper disposal. We're also going to talk to you about monitoring and supervising prescriptions, especially for the young people. Making sure that they're taking the exact amount of dose that they need to if they're prescribed to, and making sure that you're disposing of all the unused medication. Especially if it's your medication, you want to make sure that it is properly placed in a secure location where your kids cannot access it. Even if it's a refrigerated medication, it's really important to speak to your kids and teens about the dangers of taking medication that is not prescribed to them. So as you're watching this video, you're probably thinking, well, how do I properly and safely dispose of medication? And guess what? Really easy. Maybe you don't need the medicine anymore. Participate in drug take-back day. Use a medicine disposal kiosk or a drug mill. Ask your pharmacy, local police, or sheriff station if they'll accept prescription medicines or know where you can dispose of them. Use DisposeRx if your pharmacy gave you a package of this disposal product. We just discussed the many ways in which you can keep your children safe, not only with their own medications, but with your medication in the home. We'll talk to you about monitoring and accounting for all of the prescription medication in your house. It's very important that you properly and safely dispose of medication. For more information, generationrx.org.
One big part of our push to decrease overdose deaths is prevention. So we're going to talk a little bit about prevention. Part of prevention is
And we have these awesome little education packets here that talks about practices for controlled substances, how to store them, how to use them. It also goes over some disposal things. So one big thing for Dent County, a disposal site that we have is they will take the medications, they will properly dispose of them for you, for anyone, which is a good thing that we have here in our county. There's also these little disposal, they call it drug deactivation systems. And what it is you can put certain medications, your controlled substances, in this packet, you add water, you seal it tight, and you dispose of it. Which is really awesome to have, especially for anyone who has a controlled substance. This is a good packet to have. It goes over like how many medications can be placed safely in the packet to dispose of them properly. So we have these here at the health department. It also has this tool for like writing down your medications, especially important if you're using a controlled substance, to have that written down, to carry that with you. That way, should something happen, someone would know kind of what medications help fight off or control there. So these packets are available here. Also, if you have any kind of medication safety questions, we would love to see you here at the health department. We can make an appointment with our nurse practitioner or a nurse consult appointment. We would love to go over safe practices. And then I think we're going to wrap up with just some questions. So I'm going to have April introduce us, and then if you guys have any questions, we would love to answer those or if you don't, that's something.
And I always think of all these things I wanted to say, so sorry. I want to throw one thing in there that I failed to mention, which is if you're not sure if a person is having a problem from a drug overdose, if you're not sure what they took, Narcan will not hurt them. So you can administer Narcan no matter if you feel like you know what this is or not, and it's not going to have a negative impact on them or slow down any treatment that can be beneficial for them. So there's very little risk.
I have one question. First one. 5, 10 seconds.
Intermediate. And then, you know, if you feel like you need a second dose, they recommend 2 to 3 minutes. It's like, if you feel like you need a second dose, move forward. Right, yes, I'm gonna stop recording. Oh, real quick, how much is the Narcan? That's how much is the Narcan? Free. The Narcan is free, and no questions asked. Just come into the health center, and we will get you set up with Narcan, and this is for all friends, family, business owners, Good Samaritans, community members, every single person. I think, you know, like we were kind of talking before we started recording, that everybody knows someone that's probably been impacted by this. And even if you don't, it's just part of being a good citizen. And health center, no questions asked, and we'll get you some Narcan.